Alzheimer's disease definition, diagnosis, and behavioral intervention, part 1. The good news about aging is that most people age normally, and so most people will not get Alzheimer's disease despite the prevalence. There are many different types of dementia. The most common is Alzheimer's disease. The second most common broad category is vascular dementia, which is dementia due to stroke. And the third most common type of dementia is a broad class, dementia due to general medical disorders. The Alzheimer's type dementia, one of the characteristics is a phenomena called sundowning. And it refers to an increase in agitated behaviors that occur at the end of the day. It's not really understood why this occurs. There's a lot of theories about it. Most of them have to do with fatigue and absence of daylight, or simply the cumulative frustration of a day of confusion. One of the things we know is that with Alzheimer's disease, there's broad variation in people's ability to understand. We do know that trying to talk people out of things, use persuasion, it is not very effective with people with Alzheimer's. In fact, it feels threatening. Alzheimer's is a huge problem. The prevalence is staggering, really. Currently, there are 5.3 million people with a diagnosis of Alzheimer's disease in the United States. It's the sixth leading cause of death, but the most striking statistic on this slide is that there's a new case diagnosed every 70 seconds. So people often get confused between normal memory problems and someone with Alzheimer's. This chart outlines some of those differences, so you can take a look at that for a few seconds. What we know is that the brain of someone with Alzheimer's disease starts to shrink up and atrophy, and we begin to see enlarged ventricles in the brain and spaces, as well as tangles, which we'll see some slides of in just a moment. Amyloid plaques, again, we don't know if amyloid plaques are a cause or a symptom of Alzheimer's disease. Basically, they're plaques in the brain that form, and as they form, they result in cell death and cell loss. Here's a shot of what Alzheimer's disease cells look like compared to healthy cells in the brain. There are also formation of tangles, and the tau proteins. They look like railroad tracks in the brain. They're important because they're structures that neurons is affixed to, and when they get destroyed, it causes problems relative to having a support structure for neurons. So, at any rate, this accompanied by the amyloid plaques are either the causes or symptoms of Alzheimer's disease. One more shot of a healthy brain versus someone with Alzheimer's disease. Again, you can see striking contrast between a healthy brain and an atrophied brain of someone with Alzheimer's disease. So how do we diagnose dementia? There are a lot of different tests that are developed now. Ultimately, we can't diagnose Alzheimer's disease with 100% certainty until after somebody has died. However, there are enough tests now that if people have positive findings on a variety of tests, including PET scans, we can be pretty sure that a syndrome may be Alzheimer's disease. There are simple tests that we can do. Have someone draw a clock. MMSE is a mini mental status exam where a person has to respond to some pretty simple, common kinds of questions successfully. Interesting with clock drawing is that people's spatial orientation begins to get pretty disturbed with dementia. By the way, I'm using the term dementia and Alzheimer's. Dementia is a syndrome, an umbrella syndrome that describes a collection of symptoms. There are many kinds of dementias. Alzheimer's is one type of dementia. So Alzheimer's is a disease. Dementia just refers to a broad syndrome. So with Alzheimer's disease, we see changes in activity levels such as pacing or rocking, or the opposite of that, which is retardation, meaning a failure to initiate. Not surprisingly, we see people behave psychotically, and you think about what it would be like to distort your experience of reality. It's not surprising that people begin to get paranoid. We also see changes in basic drives such as appetite, sleeping ability, changes in sexual behavior and interest. And finally, we see a wide range of changes in emotion or affect. So very common for people with Alzheimer's disease or other dementias to also suffer from depression. Estimated percentage of Americans 71 plus with dementia by gender. We can see almost 17% of women over the age of 71 have Alzheimer's disease, and a little less than that for men. That's a bit of an artifact because women live longer than men. In other words, if men lived as long, we might see the same percentage breakdown. Here's a breakdown of the causes, and visually you can see very clearly that Alzheimer's is the leading cause of dementia. So what happens? We know that there's typically a 8 or 9 year run where symptoms are visible and apparent. The disease progression may be longer than that, but symptoms tend to run an 8 or 9 year course, and you can take a look at what happens at various stages of this disease. This slide is a nice visual of what happens functionally as the disease progresses for people. Early stages, people can still keep appointments, talk on the phone, fix themselves something to eat. In later stages, they may not be able to eat independently. So risk factors. What are the risk factors for dementia? Certainly age. We know the longer you live, the percentages and odds that you'll get Alzheimer's disease increase. We know that family history. If you have Alzheimer's in your family history, it increases your chances of getting Alzheimer's disease, although it doesn't mean you will get Alzheimer's disease. Health factors. People particularly that have congestive heart conditions, diabetes, weight conditions seem to be more susceptible to Alzheimer's disease. And finally, activity levels. How active someone is mentally, physically, and socially seem to be predictors of Alzheimer's disease. So in other words, the less active you are in those areas, the more at risk you are for Alzheimer's disease.